Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms.
Welcome to this week's episode of the Concussion Fix Podcast. Nikki Fraser here with Dr. Hrkal and Melinda Krynen Hill. And this week we had a great question from a member on our Q&A. And she is in her chapter of life where she's in perimenopause, menopause in that area. And she was really wondering if this area of life does have an effect on PCS, symptoms, recovery, how all those hormone changes do affect the PCS aspect. And so maybe we'll start with you, Dr. Hrkal.
Sure. Yeah. This is actually a really common question because we've done some analysis of the people that have gone through our Concussion Fix program. We've had almost 5,000 people go through it. And now we have a pretty good idea of the most common demographic is people that are in that kind of perimenopausal period of time. So women that are middle-aged. And a lot of times that this is where it not only are they dealing with the challenge of post-concussion symptoms, but now also the underlying issues of hormonal changes and imbalances. So her question was perfect because a lot of other of my private patients have asked this question and come to me for help, and also members. So here's the deal. Concussion can impact hormones. And the challenging part is that it doesn't always impact hormones immediately. And because hormones are signaling molecules, the changes happen over an extended period of time. So there's research studies showing that hormonal changes can show up to a year or more after a person sustained a concussion. So it's not like the hormonal glands get immediately shut off after a concussion. It's often there's enough left to have a decreasing level of hormones, and then finally you are going to get clinical symptoms. Now, couple that potential with the fact that someone's going through a stressful, traumatic event after, let's say, sustaining a trauma, and then going through chronic health challenges. Melinda, as you know, that in itself can cause a tremendous amount of anxiety and psychological distress. And so that also compounds the fact that you're going to have some hormonal challenges just from that. So I always talk about hormones as potential underlying factors that can lead to symptoms that can make your PCS feel and seem worse. Hormones are required to create an environment in your brain and your body for healing to occur. And so not only can the concussion itself bring on a cascade of hormonal changes that may not show up for months later, but it can also prevent healing and disrupt things like sleep and mood and cause more pain because of some of the deficiencies in things like estrogen and progesterone and testosterone. So to answer your question, it's very common, Nikki, and hormones can absolutely play a big role in this.
Yeah, absolutely. To add to that, I just find this interplay between concussion and that hormone impact that we know is such a big part of it, and then this time in your life when hormones are already going to
Yeah.
be fluctuating and imbalanced. And it's almost like, we always talk about peeling back the layers of the onion in our Concussion Fix program because PCS recovery is complex to start with. And then when you have a separate factor like or I should say subsequent factor or something that's happening simultaneous to this concussion, you're then on this separate level of like, this is a complicating factor. It's actually maintaining PCS symptoms and sustaining them over time if it goes unaddressed. So there's a few ways this happens. Dr. Paul's already kind of mentioned this, but I'm just going to summarize it because in my mind, it's so important to sort of understand how this shows up in this age group of women that are going through perimenopause and menopause. So the first one is the predisposing factor, right? Are you already in that age range prior to your concussion, which means it's likely, and your research shows us that let me know, Paul, if you've read this as well. It can almost like amplify or like bring it on earlier, right? This hormonal
Hmm.
imbalance. And then what happens is it's really confusing. Is it concussion? Is it perimenopause? Was this a predisposing factor I had? And now it's sort of like really brought that on. And it can become such a confusing picture. And because perimenopause shows up with a lot of other overlapping symptoms in the anxiety realm, particularly, people
Hmm.
can think, oh, I'm just having anxiety post-concussion without considering their hormones. So what's really interesting is, as you know, in the Concussion Fix program, as you work through each section in our step-by-step format, you first go through, how do I identify anxiety? How can I work on regulating my nervous system? And then Dr. Paul walks us through hormones. And it starts to
Hmm.
come together as like, what is this overall picture that's happening? And how can I start to make sense of any predisposing factors that I did have that could contribute to the sustained concussion symptoms I have now? Perimenopause is a huge one for a lot of women.
The simplest thing, Melinda, is if you're wondering if you're one of these people that you might be impacted by this transition as well as dealing with persistent symptoms, is get those levels tested. Go and get your levels tested by your primary care provider. A simple blood test will give you an idea. Are you creeping towards menopause? Also, objectively, do you have symptoms like hot flashes? Do you have symptoms like night sweats? Do you have vaginal dryness? Are you getting more achy and creaky joints and brain fog? Now, the last two are confusing because they can also be symptoms of post-concussion issues. Insomnia is another really common one. Anxiety is another one that also is a really common post-concussion issue. So look at the ones that are kind of really classically hormonal imbalanced. Look at
Mhm.
your menstrual cycle and then get some blood testing done to see if, you know what, this actually may be happening underneath the surface here. And we are going to need to address that, and your primary care provider or your naturopathic doctor can help you navigate this by using hormone replacement and therapy techniques.
Mhm.
Is there anything that you would recommend specifically they get tested? Because I mean, just going to their general practitioner and saying, I want to test my hormones. I feel that we have a lot of members who their doctors come back and just kind of dismiss them or say, oh, like a general panel, but it doesn't actually look at the hormones they necessarily are talking about. Is there something that you would recommend they say to their practitioners?
Yeah, so usually your primary care provider knows the basic estrogen, progesterone to test when it comes to blood. Now, there also is some additional tests called luteinizing hormone, LH, or follicular stimulating hormone, or FSH for short, and those levels go up as you get into menopause. The muddy area is this perimenopause time where hormones may not be totally in postmenopausal states. Your period might be irregular and you're getting a lot of symptoms like hot flashes, but you still might be getting your period. This is where you can use some more sensitive testing like urinary hormone metabolites, and this is usually through a naturopathic doctor or functional medicine doctor. I find them a little bit more specific and sensitive to look at how these hormones are being broken down. But at the end of the day, if you are in that perimenopausal time where there's irregularity in period and you're getting these symptoms, testing is of limited value. It kind of is helpful if you're not really sure if this is happening and there's a lot of overlap that's looking very similar to PCS symptoms. But really, it's your clinical presentation. Or do you have a lot of the symptoms we just talked about? And that is really the indicator of how well is hormonal replacement therapy doing in terms of resolving the symptoms. What I mean is that if you take estrogen, progesterone in usually topical forms, progesterone can be taken orally as well. Do the symptoms we just talked about, do they go away? And that is a good barometer of, you know what, this is actually on the right track. One of the best ways I've ever heard it described is by a colleague, Dr. Mark Gordon. He's an endocrinologist that practices in the US, and he described as hormones create a neuropermissive environment for the brain and the nervous system to properly function and heal and recover. So the hormones create that environment so your body can actually go through the rehabilitation process. And balancing those hormones is a key therapeutic window.
Yeah, absolutely. It's sort of like taking it's that other layer of the onion, like how can we remove certain barriers that are preventing you from recovering, right? If your hormones don't create a neuropermissive environment for healing, it makes sense that that ends up continuing to be a barrier and maintains PCS symptoms. Now, even before testing, one of the things that I get a lot in my practice and find can be a helpful tool is thinking about mental health symptoms of anxiety, panic, and how that compares to perimenopausal symptoms. So you can almost like run a test yourself at home just to see if you think that perimenopause may be contributing to your anxiety or panic symptoms. Sometimes it's depression as well, but a lot of the times it is this anxiety. And so, two things you can test at home is um, are you getting hot flashes? Oftentimes that's at night. And are you waking up between that 3 to 5 window? Those are two things that are can happen in anxiety and panic, but are unlikely to be so specific. And the other piece is tracking your cycle and figuring out whether times that you feel anxious, overwhelmed, irritable, really low, even that sort of like we talk about hyperarousal and hypoarousal of the nervous system, right? So hypoarousal or being outside of our window of tolerance, our nervous system's overstimulated, often presents as anxiety, panic, restlessness, irritability. But if we're sort of more in the hypoarousal or on the lower end of our window of tolerance, we can present as like being shut down, numb, depressed. And either of those things can happen when we're cycling. And so we can kind of decide, wait, am I about to get my period? Is it the week before my period? Is it following, my 5 days of bleed? Does that end up with me then having less symptoms, right? Typically, following a period until ovulation or through the ovulation period, women get a lot of relief from those mental health symptoms. So that's another way you can kind of track at home is my hormones related to my cycle? Could perimenopause be part of this picture? And those are just sort of like at home hacks that you can sort of work on your own to figure out, is this something, should I go get more testing? Because you might be uncertain, or, maybe it isn't the case for you that your mood cycles with your menstrual cycle. It could be just all the time. And maybe that points more towards other things.
Mhm.
Absolutely. Well, I think that's kind of a great spot to kind of wrap it up. Any last words for our listeners, Dr. Hrkal?
Hormones can absolutely impair your ability to properly function. It can impair sleep. Melinda talked about really eloquently about how it can impair mood. And this is a key piece of the puzzle that would be really important for you to address and treat. If you're in that 45 to 55 range, then you absolutely should get this assessed. And it may really help your recovery trajectory if we can actually balance your hormones to create that neuropermissive environment. So I'm really glad we had this conversation because I think it can help a lot of people.
Yeah.
Awesome.
Paul, I wonder, and I know we're trying to wrap up here, but I wonder if we would even bump that age range for PCS women. Do you think it should be 35 to 55? Because what if you get a concussion at 35 and it sort of enhances that perimenopausal tendency or that susceptibility, I should say? And because I find that, even in my practice, there's a lot of women in their late 30s starting some of these things, and particularly with concussion or other types of trauma, injury, illness that can actually fast forward that trajectory. So just a thought around what age range do we think
I mean, I think we
people
could
should be
probably extend
aware
it down to
of?
40. I mean, any of in that middle age reproducing years of a woman, you should be thinking hormones. Absolutely, if you sustain a
Yeah.
concussion and have persistent symptoms. Again, hormones don't always show up within the next couple weeks or even couple months. It may come on much later, and you can get really general vague symptoms like fatigue, PMS, things that often a lot of people and women don't associate with persistent concussion issues, but it can be because of the concussion was kind of that triggering effect. And so now balancing those hormones can play a really key role. So, be thinking about it anywhere from age 40 to even age 60. But in my experience, the majority of people are from 45 to 55. But of course, you can have those outliers.
Absolutely. I think I would echo the same comment, is just not to underestimate the impact of hormonal dysfunction or hormone dysregulation on your PCS journey. If it seems like this might be something that you're struggling with, go get it checked out, get some more testing. There's so much within the Concussion Fix program that can guide you as well. But it is an important topic, and I'm glad that we talked about it today.
Yeah, absolutely. So as Melinda just said, if you want to learn more about this and go even deeper, always check out our website, www.concussionfix.com. Thanks for listening to the Concussion Fix podcast. Remember, recovery is possible. You're not alone. Have a great day, everyone. Bye.
Bye all.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.